Health assessment.
List of health assessment. Eyebrows and eyes nosmith and pharynx zone anterior or posterior chest abdominal.
Good morning, sir. My name is RJ Lapitan, student nurse for this morning and at Foundation University. So may I know your name, sir?
Vincent Yukubanan.
And how old are you?
I'm si Vincent.
And where do you live, sir?
Kalaligang Balinsana Luzon, Tap.
Now, sir, we'll do assessment of your eyes. Your eyes assessment is your eyes is a sensory organ of your vision. So we'll proceed to just wait for a while, sir. I will prepare all the equipment I need for this assessment. So may you want to use comfort room? No? So just wait for a while, sir. I will prepare all it. Assuming that I already prepare all the equipments for the eyes assessment, so sir, I will close the drapes and the door for your own privacy. It's okay to you, sir? Close the drapes. So sir, we'll take your vital sign first, okay? So we'll take your BP, temperature, and then your pulse rate and respiratory rate. Before I proceed the procedure, I will do a hand hygiene. So sir, I will before um, taking vital sign, I will wear also gloves for your. As you see, sir, I already wear the gloves, so I will take your temperature first and your pulse rate. It's okay, sir, to touch you. So, sir, your temperature is 36.5, which is normal. So, so your pulse rate also is 80, and it's normal also, and your respiratory rate sir, is 12 cycles per minute. So, sir, I will take your vital sign, which is your BP again. Okay, vital sign. Can hold this for a moment, sir. Can you rest your arms? So your blood pressure, sir, is 120/80, which is normal. So sir, we'll proceed to your eyes assessment, which is your visual acuity, cranial nerve 2, which is your optic nerve. So sir, we have to proceed uh, technique, which is your far vision technique and your nerve vision technique. So the nerve vision technique, sir, we use a Jaeger chart. So sir, so assuming this is Jaeger chart, or so sir, can you read aloud, sir?
College of Nursing, Foundation University, Dumaguete City.
So the nerve vision of the patient is normal because the patient can read without difficulty. So we proceed to your so thank you, sir. We proceed to your far vision. So we use a Snellen chart or E-chart. So sir, I will be pointing here a words. So can you read aloud? So please first can you cover your left eye?
E F P T O Z L P E D F E E C.
So the patient can read the Snellen chart. So the patient must also 20 feet away from the Snellen chart. So the patient can read without difficulties. The ocular sinister um, is 20/20, which is normal, sir. So we proceed to other one, sir. Can you cover your left eye to plus your right eye? So again, sir.
E F P T O Z L P E D F E E C F D.
So the patient can read also. So the oculus dexter is normal, so it has 20/20, which is normal. So we'll proceed to your extraocular movement, sir. So can you follow my finger? I will move this 6 gazes direction. So sir, ano? So the patient can follow my fingers movement. So it's normal. So you can follow without difficulties. So we proceed to your visual field, sir. So visual field. So the patient must 20 feet away from the the, the examiner. So sir, can you close your eyes? Right eye. Can you close your right eye? Cover. I cover. Right eye. Right eye and then I'll go upper my left eye. So sir, can you see? So do the opposite one, sir. The opposite one. So the vision field of the patient is normal because he can follow the wiggle hands without difficulty. So we proceed to your external eye structure. So sir, we uh, inspect your external eye structure. So your eye, sir, is not protruding and it has color at same at in your face. So, sir, proceed to your. It's okay, sir, to um, palpate your eyebrow. So, if there's no masses. So, the patient, your eyebrows, sir, is color black and also symmetrical and evenly distributed your eyebrows. So, sir, so there's no presence of masses. And so, we proceed to your, so your, so proceed, and now we proceed to your, so your eyelids. So, sir, can you look up, sir? I will use my tongue to lower your eyelids. Check also your conjunctival sclera. So your eyelid, sir, is normal, and also your conjunctiva is color pink, and it has some moist, and then your sclera uh, is not a nectar, and your sclera is not it has not a discoloration of yellow, which is jaundice, and which is your sclera is a nectaric sclera. So I proceed to 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 your cornea and your lens. So your cornea, sir, is reflective, and your okay. Go. So your cornea, sir, is reflective, and your lens also is translucent. So there's no also presence of opacities. So proceed to your iris. So your iris, sir, is color brown, and it has a shape of circle. So we proceed to so so your pupils. So also I will turn adjust the light so it will be uh, more effective. So sir, your iris or your pupil, sir, is color black, and then it has 3 millimeters of size, and then so the you're doing pupillary light reflex. Your pupil constrict when the light shone onto you, and also the other one is constrict also. So proceed to your so which is normal. So we proceed to convergence and accumulation. So sir, can you look the far direction? Yeah, far. And then transfer the gaze here in the pen. So sir, we already do the convergence. So the result, sir, your pupil is dilate where you're looking the far direction, and then so so the your pupil contract while you are looking at the pen in your closely to your eyes. So proceed to your accommodation. So can you look here? So the accommodation of the patient is normal because the pupil turned inward while he's looking to the pen light closely to his face. So the result, sir, is perla, which is pupil are equally rounded and reflective to light and accommodation. So we proceed to your nose, sir. It's okay for you, sir. So nose assessment is your sensory um, sensory organ of your smell. So, sir, I will also
Go.
so sir, I will inspect your your nose. So, sir, your nose color is the same color of your face, which is light brown, and then the symmetry is it has a symmetrical, and the shape is there's no deformities, and then the size. It's normal like so I proceed. So also, sir, there's no inflammation in your nose. So I will. It's okay, sir, to palpate your nose. Touch. So did you feel tenderness? Okay, sir. I will proceed to your internal structure. So, sir, can you backward your head? Ano lang? Ano lang? Ano lang? Ano sa ano? So, nasal mucosa is color pink, and then it's not there's no presence of inflammation and bleeding, and also your nasal septum is there's also presence of bleeding also. So proceed to your test nasal patency cranial nerve 1, which is your um your ol- your olfactory nerves. So proceed to I will use the cottony balls. So, sir, it's okay to you, sir, to proceed the test. Can you close? I will use can you distinguish what is the substance that I use here, sir? So can you close so um your nose, left nose hole? You smell, sir? What's and the other one? So your test nasal patency, sir, is normal because you can smell the substances that I use for the in the cotton ball. So, sir, I will palpate your synostosis. Can you look down, sir? So I will palpate your frontal synostosis. Can you look down? So do you feel pain, sir? No? So maxillary synostosis also, sir, I will palpate. Do you feel pain? So, sir, we proceed to already done for your um, nose assessment. So the result is normal. So so we proceed to your mouth assessment. So, sir, we're all done to your nose. So we'll do proceed to your mouth assessment. So, sir, I'll inspect present inflammation and it's moist also. So, sir, I will palpate also your lips. It's okay to you, sir. So, you already changed the gloves, and then so there's a pain, sir. So we'll proceed to your vocal mucosa and your gums and your teeth. So I will inspect supply. I'll be using tongue disperser. Can you open your mouth, sir? So your white your vocal mucosa is color pink, and also there's no presence of um, bleeding, and also your gums there's no inflammation while doing the inspection, and then also your teeth is um, white and shiny. And so, sir, we'll proceed to your. So I will inspect your also or palpate by using your. Can you show your tongue, sir? Ah, sit up. Let go now. So the color is color pink, and it is so moist, and there's no deformities your tongue, and there's no also a presence of lesion, ulcer, and nodules. So, sir, I will ask you, sir, can you move your tongue up? So we'll test your cranial nerve 12, which is your hypoglossal nerve. Up, down, side, the other side. So the cranial, the test is normal because you can follow without difficulties. So parents, proceed to your parents. So sir, can you open big mouth? So say ah. So the color of the palate is pink and moist, and there's no also presence of inflammation and lesion. So there's also presence of enlargement. So we are all done for the mouth. So sir, we already done to your mouth assessment. So we'll proceed to your neck assessment. So, okay, sir. And also the neck and also the lymph nodes also. So we'll do assessment of that. So first we'll inspect your neck. Can you extend your neck, sir? So the neck is urban symmetry, and then there's no scars. I guess here you have a mole and the left side, and also there's no enlargement of carotid gland. And also, sir, we're done for the inspection, so we'll do to palpate your lymph node. So I will go back to here. Place your lymph nodes in the back, so it's okay, sir. So we'll proceed to the pre-auricular, so, post-auricular, occipital, tonsillar, submaxillary, submental, supracervical chain, posterior cervical chain, deep cervical chain, and the last one is supraclavicular. So upon palpating your lymph nodes, sir, there's no presence of inflammation of your lymph nodes and then nodules. So proceed to your trachea. So, oh, so upon inspecting your, so we proceed to your thyroid gland. So I will have a water piercer. Can you extend your like this and drink the water? Just, just. So there's no presence of masses. So I really observe. So so there's also so all done, sir. So the thyroid gland, the thyroid gland is normal. So there's no presence of masses. And then, sir, um, we all done for the posterior and anterior chest. So we'll proceed to the abdomen. Sir, can you lay down there? And now we'll proceed to your abdomen. So sir, I will inspect first if there's so there's no presence of lesion and also deformities and enlargement organ. So we proceed to your auscultate. Also auscultate also. And now I'm done auscultating your abdomen. So proceed to your percus. So I'm done for your auscultate inspection auscultate and percus. So So I will also note for the size of your liver. So your liver, sir, is 12 centimeter. So it's normal. Um, the inspection, auscultation, and percos will put you to palpate. Okay, sir? Palpate. I will palpate you. You feel pain? And also, sir, can you set my position, sir? Assist me. Also, just lean. So done. Feel pain? You feel pain, sir? I go now. You feel pain? So I will do heart palpation. Do you feel pain, sir? Do you feel pain? So I don't feel any nodules and masses. So that's all. So thank you, sir. So thank you for the fully cooperation. So that's all for the assessments. So God bless, and I will do aftercare to my all equipment. Thank you, sir.